Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us this morning. Before we begin, I'd like to thank our sponsor, Studio Arts and Glass, Cleveland Clinic Mercy Hospital, and of course, our socially distant technical producer, J.D. DeAngelis. Today, Brad and I are broadcasting from our administrative offices, and our very special guest is Jim Adams, Health Commissioner for Canton City Public Health. Good morning, Jim, and welcome back to the show.
Good morning, Paul. Good morning, Brad.
Good morning. There aren't many topics more widely or hotly debated than COVID-19. From vaccines to masks to public policy for schools, restaurants, and public venues, everyone has an opinion. This morning, we're fortunate to share this time and space with Jim Adams to set the record straight and talk about how the facts and myths surrounding COVID-19 affect us all. We'd also like to thank Jim and the staff of the Canton City Health Department for their tireless efforts on behalf of the health and safety of our entire community. We thank you very much. We'd like to remind our listeners today that our program is also available on our podcast, which can be downloaded from the App Store on your mobile phone. Just look for Health Matters with the Medicine Center Pharmacy, and you can listen to any of our programs anytime.
Okay, Jim, so welcome back to the show. You've been on before, and again, tell us a little bit about yourself and introduce yourself to our listeners.
Yeah, sure. Here we are again. It just seems like yesterday. But I am the Health Commissioner for Canton City Public Health. We're one of 4 health districts that are located in Stark County. We have 3 city health districts, each with their own department, and that is Canton City Health District with its own health department. We also have Alliance City that has the department that serves Alliance City. And we also have Massillon and the department that serves Massillon there. The remainder of the county is served by the Stark County Combined General Health District. And so, between those 4 departments and the staff in those 4 departments, we look out for the public health of the entire community there. I've been with the department since 1985. I came here from the Cleveland area after working at Lorain County Public Health in 1985 and was the environmental health director for a number of years. And about 12 years ago, then I was appointed as the health commissioner, and just in time to help us navigate through COVID.
Okay, when we last spoke in January of this year, and our focus was on sharing information regarding the safety of the vaccine. Can you provide us with an update on vaccine rates for our community?
Sure.
And along with current guidelines and recommendations for vaccinations for our listeners?
Sure. So we know that vaccine is really our best strategy for navigating out of COVID. We have, in the past 8 to 9 months, we have turned COVID from a disease where we only had non-pharmaceutical interventions and mitigation strategies such as face covering to it turning it into a vaccine preventable disease. And of course, as pharmacists that vaccines are a lifesaver for many, many people, and it is for COVID. So our vaccination rates are slowly rising across the state of Ohio in our community. Right now in Ohio, about 60% of individuals have started at least 1 dose of vaccine. Stark County is a little bit less than that, about 56%. And Canton is about 55%. So the completion rate is a little less than that. Right around 50% of the eligible population has completed their vaccination series in Ohio so far.
Okay, so the news about COVID seems to change almost by the hour, depending upon who you listen to. So today is a lot of talk about the Delta variant.
Sure.
Can you give us, our listeners, an update on the status of this pandemic, both globally and community?
Yeah, so we know that the initial wave of COVID virus was the original wild type virus. And in the last month or so, the United States has started to experience a wave of several other variants, most notably the Delta variant. So there are about a half a dozen other variants from the original wild type virus. However, worldwide and in the United States, the dominant variant is the Delta variant. We've been told that virtually all new infections in the last month or so have been caused by the Delta variant. And what we know about the Delta variant, it is much more infectious than the wild type virus. In some cases, it causes a slightly milder disease, especially if you're vaccinated, but it spreads very, very easily as compared to the original wild type virus.
You know, the vaccine's free, and just about everybody in the world ought to know that now, or at least in America.
Mhm.
And some folks, there's other incentives to receive the vaccine. Can you talk about the availability and the ease of receiving the vaccines?
Oh, sure. So, early on, vaccine supplies were very limited in the United States. And so we had a tiered approach for vaccination. I think we talked about that before, eligible populations. Well, since then, now we have an abundant supply of vaccines. The federal government has even shipped significant amounts of vaccines overseas to help in their efforts. And that's all very good because we do need to be mindful that this is a pandemic, a worldwide pandemic. Vaccines are widely available in the community. In fact, most vaccines in the last 21 days have been provided by pharmacies. About 83% of the vaccines administered in the last 21 days have been done by pharmacies such as yours. And so, having pharmacy partners in the community is extremely important in distributing vaccines. So we want people to go to places where they normally receive their health care, places that they feel comfortable in getting their health care, places they can get their questions answered. And so our pharmacy partners play a big role in that, along with our other healthcare partners. But health departments still continue to provide a fair number of vaccines in the community. They are widely available. There is no charge for vaccinations. There's no out-of-pocket expenses for vaccinations. And as I stated at the top, vaccine is really our key strategy in the moving out of this pandemic.
So all along there have been concerns about the safety of the vaccine or vaccines, and now the boosters are being recommended. These concerns seem to be in the forefront again. Can you talk about safety and
Sure.
protection rates and why this vaccine is so important?
Mhm. Yeah, so safety. So we've talked before about the types of studies that have occurred to bring these vaccines to market. A typical new vaccine might have 3,000 to 5,000 study participants before it's released to market. These had 30,000 to 40,000 participants before it was even authorized under the emergency use authorization. So, there's been an exponential number of people that have gone through these vaccine trials even before it was released. Now since then, we've had millions of doses administered to the general public, and that vaccine safety program still continues. The vaccine manufacturers as well as the FDA still continually review any reports of any potential adverse effects. Each one is scrutinized carefully, and the system is very sensitive. And any concerns, any problems that might pop up as part of these vaccine safety reviews is thoroughly vetted. We might remember that a month or so ago, there was a concern with Johnson & Johnson vaccine as far as myocarditis in certain populations. And they made a brief pause in the administration of that vaccine in order to thoroughly evaluate that. And that was a very small number of cases and a very huge number of vaccinations. So it's a very sensitive system. This has turned out to be an historically safe vaccine with very, very few significant side effects.
So, okay, how about the boosters? All kinds of talking about the
Boosters?
boosters now,
Yeah.
crying out loud. Can you explain the current guidelines for those who are
Yeah.
immunocompromised as well as far
Sure.
as the general population who received either the Pfizer or Moderna? Now,
Sure.
I got the Moderna down at the health department, okay, back in December. Do I have to go get a booster shot?
Sure. So of course, as we are learning about the vaccine and about the evolving nature of the pandemic, medical recommendations will change because of that. And so as we've learned, certain individuals that have very weakened immune systems, severely immunocompromised, these are people that might have organ transplants and are on immunosuppression therapy, like a solid organ transplant, or certain types of cancers where they have really high steroid or immunosuppressant therapy. A list of some metabolic or some immunocompromised conditions, and I'm not familiar with, but the list was in the CDC. So it's a pretty small number of people. They have found that their immune system does not, adequately confer immunity after 2 doses of the vaccine. So they are recommending a 3rd dose of vaccine to help bring up their immunity for that. And, We see that in other vaccines. There are some vaccines for children that require 3 or 4 doses of vaccine before full immunity is conferred. So, it's not unusual in vaccines to have several doses of vaccine spaced out over, an adequate time period in order to build that immunity in a person. The question about boosters is coming out of some studies that were done of people that were vaccinated around December, about 8 or 9 months ago. There is some concern about a little bit of waning immunity, over that period of time, and also the impact of the Delta variant and on how the vaccine is how that's responding because of the Delta variant. So because of those two things, the federal government is going to begin to recommend, I think, booster doses starting around September 20th, but they're still developing the guidelines around that. And again, as we occasionally require boosters for other vaccines. Tetanus is probably a good example. We recommend a booster dose of tetanus vaccine every 10 years. And so as we, learn about the coronavirus vaccine, those kinds of recommendations will change over time.
Why don't we take a break here, Jim? You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are talking with Jim Adams, Health Commissioner for Canton Public Health.
Okay, well, before the break, we were talking about the current vaccines, their availability, and the booster discussion. How are you going to manage the distribution of booster vaccines at the health department? Are you going to be reviewing vaccine cards, or do you have another method that you're going to use?
Mm-hmm. Yeah, so we're still in the early planning stages for that. Only just a few days ago, the federal government announced plans for recommending booster vaccines. I think they're going to develop some more specific recommendations right around September 20th. So we'll know a little bit more about how that is going to work. We've been discussing with the Ohio Department of Health how we are going to use the existing immunization registry to provide notification of people that have been previously vaccinated. And then an efficient method and a method to efficiently provide those vaccines for people that do choose to get a third booster dose. Right now our vaccine rates are very, very low. We're only at the health department, we're maybe administering 20 to 30 vaccines a week. So that's a very, very low number. We do anticipate that to increase as people are concerned about the Delta variant. We've seen a slight increase in the number of people getting vaccinated with their first or their second dose. In December and January, we vaccinated on the order of 1,000 or 2,000 people a week with vaccines. So, we're looking to see what kind of impact that makes on our capacity to kind of stand up and be able to do that kind of volume again. So we're still in the planning stages for that.
Okay. You touched a little bit on this in the first segment, but because the vaccine was developed and released to the marketplace so quickly, I hear that customers sometimes express concerns for long-term side effects that we haven't had the time to study or know about yet. Can you comment on those probably natural fears anyone has with a new therapy? So,
yeah, I think the thing to focus in on is that this has been very carefully vetted through the existing mechanisms for looking at drug therapies and vaccination products through the FDA. They've not changed their process at all for that. And so as they've gathered, the normal process is you start to review the data. If it is of a special importance, like a COVID vaccine was, it could be authorized for emergency use, which they did. They continue to gather extensive safety data and long-term data about the vaccine and its effects. And then eventually, if applied for by the company like Pfizer has, it becomes fully licensed as a fully licensed product. And then it goes into the regular maintenance cycle of, analyzing the effects and things like that. So I think we have, the United States has a very, very sophisticated, a very sensitive method of developing drugs and therapies. And none of that has been circumvented in the production of this vaccine. And I think I mentioned before, Brad, that the miracle about this vaccine is they started working on this technology about 10 years ago, and so this is the first time they've been able to really kind of use the technology It's not a brand new technology, but it holds great promise for quickly developing vaccines for other types of conditions as they emerge. And so the underlying technology is a proven technology. I think we've shown that this technology can respond quickly to an emerging threat. And so I think it bodes well for our future if we accept these vaccines and accept the work that people are doing.
It's been fascinating as a pharmacist to think about where we've come from. And I'm sure my father can comment on it too. I mean, it's really neat to be able to see how the tracking systems are done. And if you opted into that, their mobile app so that you could report any symptoms you had. I almost wonder, and I don't want to overstep what I know, but I almost wonder if this is probably a situation where these vaccines have been monitored on a level that has never been seen before in a prescription drug administration process. But, I know we have clinical trials and they monitor everything, but this is like a massive clinical trial with a bunch of data points, which really should provide a wealth of knowledge going forward.
Yes, absolutely. It's probably been the most studied vaccine development that certainly I've ever heard of.
Yeah. So if we're out at a restaurant, a grocery store, or shopping, or even at our place of worship, what should we be doing to be mindful and keep ourselves healthy and keep those around us healthy?
Sure. Well, we've been through this before, so this is not new to us. And we know that we can take some reasonable efforts in the community to help keep ourselves and our neighbors safe. And the very first thing that we can do that we didn't have at the beginning of the pandemic was get vaccinated. So, we should really think of vaccine as that first level of defense, that first level of protection. But there are other things we can do if we're not fully vaccinated. And one of those is if you're indoors in a public place, you can wear a face covering. So we did this at last year about this time, we did that. We wore face coverings while we were indoors in crowded places. And it had a good effect at helping prevent and slow the spread of the COVID virus. So wearing a face covering is going to be important. Obviously, hand washing is very important, always is, in preventing the spread of any respiratory viruses. And the last is staying home when you're sick. And I think that we've kind of underappreciated the value of what we asked people to do for COVID, which was really be mindful of your symptoms. And if you felt any kind of illness at all, we asked you to stay home. And I think that had as much or more impact than wearing a face covering did, for example. So if we continue to do those things, we know that we can have a very, very strong and positive impact on the spread of respiratory viruses in the community.
Okay, break time again here. It's bottom of the hour, time for the news. Thanks for joining us on Health Matters with the Medicine Center Pharmacy. We are back. You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today, we're talking with Jim Adams from the Canton City Health Department.
Okay, Jim, it's back to school season somehow. I don't know where August went, but I know Canton City schools are requiring masks for students and all individuals in the schools. Other school systems are requiring masks or not requiring them, depending on your age group, if you were able to be vaccinated. And Ohio State made some changes Monday. Some other things have happened with some big commercial companies in the past couple of days. What concerns do you have for school-age children and recommendations for parents and grandparents to keep students healthy?
So our goal, I think, like the rest of the community, is to make sure that our students are in school every day. It's important for their social development. It's important for their intellectual development. It's important for ourselves as a community to make sure our kids can stay in school. And so the concern is, of course, is that we're starting school in another surge of COVID right now. And we know the right choice to make is to have our students wear masks while they're in school. CDC recommends universal masking in a school-based setting, which means in the classroom, on the bus, indoors as much as possible. So that is our recommendation. We'd like schools to follow and parents to follow the recommendations that CDC has put out, and we suggest universal masking in all school indoor situations. In Ohio, that decision to require masking has been pushed down to local school districts. And so you will see a variability in how different districts implement that based upon, the characteristics of the district. So as you mentioned, Canton City Schools and a couple other school districts in Stark County have required universal masking during school events. That will help manage COVID cases in the classroom significantly. And so we would encourage all school districts to carefully consider their decisions, and if it's appropriate, require universal masking within the school district. So that'll help get our kids to school and get them back safely. The other thing that we have available to us now that we didn't have in the first part of the pandemic is we have a vaccine that is available to students in the upper grades. So we have a vaccine that's fully licensed for those 16 and older, and you can still use that vaccine as an emergency use vaccine for those as young as 12. That's the Pfizer vaccine. So again, we'd encourage vaccination. Certainly all the staff and all the ancillary folks that help make a school run should be vaccinated if they can. And that will help keep our kids in school.
Do you have any, I'm afraid I have not seen it. Maybe you have. I know that there were some other trials going on for younger kids. Do you know where we're at for below 12 at this point?
I believe that Pfizer has submitted some additional data for children as young as 2 years old. And so, what the FDA will do is when they get that data, when there's enough of that data to analyze, they'll look at that data carefully. And I think you'll see over time, you'll see these ages go down and down as far as what will be authorized for use in those areas. So Pfizer, of course, was the first one to put that data out there and request that authorization. So I'm not sure where Moderna is in that process or the J&J vaccine, but of course, we know that earlier this week, Pfizer, FDA did fully license the Pfizer product for children 16 and older.
Mm-hmm.
Interesting. Okay, here we are at the beginning of flu season, sort of. Does the health community have a prediction for this year?
Sure.
Health.
It's really, really strange. Last year, we had not much of a flu season at all. And I am fully convinced that was because we were staying home and we felt ill. So, we had not a lot of social contact through the flu season last year. So we know that if we stay home when we are feeling ill, if we wear a face covering when we're out in public, that we're going to really diminish the possibility of spreading flu viruses. So that being said, some experts are saying, since we didn't have much of an exposure to flu last year, that we may be especially sensitive to exposures this year. So I think it's especially important to get that flu shot this year, even if you didn't get one last year, because we've not been exposed to the flu very much. So any kind of exposure is going to be that much increase that risk of flu transmission. The corollary to that is what we've seen with a virus called RSV. Typically affects younger children, but usually most kids get RSV by the time they're 2 years old. And so we had a season last year where there was very little RSV. And once the mask came off and once we started getting together in the summer, then we've had a significant spike. The country, that is, has had a significant spike in RSV. And so the fear would be that could happen with flu if we're not vaccinated for flu. So vaccines for flu, it's a vaccine preventable disease. Vaccines for flu are still very important.
And can you get a flu shot along with the corona?
As far as I know, I'd have to read all the labels one more time just to make sure, but I think that you are authorized to get additional vaccines at the same time as you can get a COVID vaccine.
Okay. So last year's COVID requirements for masking and social distancing seem to be curtail the spread of flu, which we mentioned here earlier. But normally we give quite a few flu shots, and it didn't come to us last year, and I know a fair amount of the population didn't get a flu shot. But I suppose it was the mask wearing and hiding in your home. And I mean, I talked to people last year, they didn't leave their house for 6 months. Mm-hmm. I'm thinking, how'd people eat?
Right.
You must have had somebody deliver the food to you. So,
right.
So what do we tell people?
Get your flu shot. If you're going to be out and about, it's still very important to get a flu shot. Most of, these vaccine preventable diseases, so the vaccines are there for a reason, and we should avail ourselves to them to keep ourselves healthy.
What about other vaccines that the health department want to bring to our listeners' attention?
Yes, we offer a variety of vaccines. We have a full suite of childhood vaccinations that we can provide. We have a child vaccine clinic that we offer. We also offer a travel clinic, and that'll can provide some adult and some children vaccines for people that are traveling, such as yellow fever, tetanus, hepatitis vaccines, and things like that. That information's on our website as far as what vaccines we have and what clinic offerings that we have. You mentioned Paul, childhood vaccination. Childhood vaccination rates have really declined over last year. There's a couple of reasons that we think that occurred, and one of those is that people were not going to the doctor as often as they did previous to COVID. And so it's very important that families take their children to the doctor at their regularly scheduled visits and keep up with those vaccination schedules. As you know, when we are deficient in our vaccination schedules, those kids are really at risk for some very significant illnesses. So it's important to get our kids caught up with their vaccination schedules and to maintain those schedules.
Well, I think I've heard that some of the old disorders have kind of sneaked back in the population, not dramatically, but in a few places, big cities, stuff like that.
Mhm.
I think I heard plague somewhere for a few doses or a few cases out in California or something like that. And I think, God,
Yeah, in some areas of California and out west, plague can be endemic. They'll have a handful of cases every year. But obviously, if you're not vaccinated against a vaccine preventable disease, there's still a reservoir of that disease out in the community, and you can have outbreaks. And a few years ago, famously, we had a measles outbreak in Ohio, centered in a mostly unvaccinated population, and that was significant. And so vaccines, again, are key to preventing these large outbreaks.
So, Jim, I think we've all been kind of watching the newspaper and the websites with a little bit of dread as we see these cases on the rise again. What are the current recommendations for quarantining and isolation if you've been exposed to someone who's tested positive for COVID?
Yeah, so the quarantine and isolation recommendations have not changed for the past several months. So they're pretty well entrenched, and they do work, right? So if you are ill, you do isolate. And I always, somebody had taught me that ill starts with I, and isolate starts with I. So if you're ill, you isolate. So, the recommendation for isolation is for 10 days from the start of your symptoms, or a positive COVID test if you don't have any symptoms. And then after the 10th day, which is the 11th day, as long as you don't have any, if you don't have any worsening symptoms, if your symptoms have improved, you don't have any fever, you can go about your normal activities. Quarantine is a similar period. So the official quarantine period is actually 14 days, but most people can go back to their normal activities after the 10th day, provided they continue to wear a face covering.
Okay. What is the health department still doing contact tracing?
That's a good question. Yes, we are. We are very stressed with contact tracing. The number of cases have rocketed up at a pace that was much more significant than it was last November. But we do contact tracing. We prioritize our contact tracing to people that we believe are in congregate settings, in schools. So things like nursing homes, shelter type operations, and especially schools. And we will try to do a more detailed contact tracing for those individuals. For other individuals where we don't have a lot of information about their potential contacts, we will contact them at least by a letter and let them know that, they may already know, obviously they probably already know about their COVID status, but we let them know that, yes, you're positive for COVID. Here's what we think you want to do. Here's what your isolation period should be. Certainly reach out to us if you have any questions. So yes, we are continuing to do that.
Okay, Jim, our final breaks here. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. Thanks for joining us today. Let's get back to the last segment of the show.
Okay, I know many of the local libraries offer free home test kits for COVID. They're offering the Binax Now home health kits. Jim, can you talk about the accuracy of the kits and what listeners need to do to make sure they use these kits correctly?
Yeah, so the home test kits, that's a nice addition to our ability to give people information about their COVID status. They are a home kit. You can administer them at home. They take about 15 or 20 minutes to complete. Relatively easy to do. It looks to me a lot like a home pregnancy kind of kit, the way you interpret it. They are accurate if they're used for their intended use. So they're really designed to look at somebody that may already have symptoms and determine whether or not if the symptoms are caused by COVID or not by COVID. So they're designed to, if you have symptoms for a couple of days, 2 to 3 days, the COVID test, using the home test kit after that third day, they're really quite accurate. If you are asymptomatic, they really don't have much use because you need to have the presence of some viral particles really to tell whether it's positive or negative. So within their context of use, they can be very good.
How are those tests reported to the health department, and what recommendations can you offer to individuals who do test positive?
Yeah, so I'm familiar specifically with the Binax Now test kit, which is an Abbott product. You are administered the test by being observed by a proxy. So unfortunately, it does require access to some technology with some type of video camera like a cell phone. A live person will watch you, observe you do the test and help guide you through collecting the sample. The test comes with a specific code that's scanned into your phone when you do the test. And then those test results are reported to the state health department pursuant to the regular rules and laws for reporting lab results.
Okay. All right. There's a lot of talk about breakthrough cases for individuals who've been vaccinated. Can you speak to that along with your opinion on the efficacy of the vaccine?
Sure. There have been a couple studies that have come out in the last week about vaccine efficacy, particularly against the Delta variant. Most of the breakthrough cases are from these variants rather than the wild type vaccine that was out last year. They range anywhere from around 60% to more than 90% efficacy, depending on the situation. So in some nursing home settings, they're seeing vaccine efficiencies, fall down to less than 50%. And I think that they believe that's related a lot to the age of the individual and the robustness of their immunosuppression systems. So it does vary widely, and part of it is due to the Delta variant, and some of it may be due to waning immunity, but they've not been able to kind of characterize that carefully yet.
Okay. The health department offers so much to our community, and we focused on COVID today for the most part, but how about some other services or upcoming events that you'd like to bring to the attention of our listeners today?
Sure. So, we do provide a lot of information to the community about a lot of other factors, and we, certainly welcome people to ask us questions. For example, at the farmers market, we have provided information about our other services for the health department. So we're at the Canton farmers market on a regular basis. One of the projects that we have had for a number of years since the late 70s is our WIC project, which is Women, Infants, and Children. So that's a supplemental food program for pregnant women and children up to the age of 5. It's a great program, provides nutritional counseling, supplemental food, heights and weight checks for kids, a lot of assistance for moms to help successfully breastfeed. So we really would appreciate people coming and asking us about our WIC program and learning about the services that we can provide along there. We still do a lot of HIV testing and counseling. So we run a regular HIV clinic for people to come and get information about HIV and testing. And one of the hidden things that a lot of people don't think about, but it's still extremely significant, is sexually transmitted infections. So we do run regular sexually transmitted infection clinics. We know that chlamydia and syphilis are both on the rise across the country, and in particular in Stark County. And so those kinds of infectious diseases have not gone away and in fact gotten worse over the pandemic. And so we still provide services along that area.
Okay, Jim, can you share your contact information for the health department and along with your website for the listeners?
Sure. Yeah, we've got a lot of information at our website. It's cantonhealth.org. And we should have, information there to answer some of your questions. Our nursing main number is 330-489-3322. And you can go there to ask questions about vaccines that are available, our childhood immunization clinics, our adult clinics, sexually transmitted infections, and all things medical and nursing. We'll be glad to help you with.
All right, Jim, we got a short period of time left. How about a quick shout out for your most important takeaway from today?
The most important takeaway today is we've been here before and we know what to do. And so we do know that we have some non-pharmaceutical interventions we can do to help control COVID, masking, hand washing, staying home when you're sick. But the most important thing is we now have a vaccine, and this is a vaccine preventable illness. And so vaccination will help us get out of the pandemic.
Well, Jim, thanks for coming by again. We really enjoyed talking to you. And Jim
Thank you.
Adams, Health Commissioner for Canton City Public Health. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Cleveland Clinic Mercy Hospital and Studio Arts and Glass, and of course, our technical producer, JD DeAngelis. As always, we thank you listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you again right here next Friday on News Talk 1480 WHBC.